It's time for The Well with Lexington Health. Today we're talking about colorectal cancer screening with Dr. Sarah Cottingham. How are you?
I'm good. How are you?
I'm doing good. So, doctor, typically when we think about colon cancer, they think about it in older adults, but that has since changed a little bit with the recent passing of Dawson Creek's actor James Vanderbeek.
Yes.
Can you talk about when you guys recommend people get their screenings?
So 45 is the new 50 now. It used to be 50. A little less than 10 years ago, they changed the screening age to 45 for average risk patients.
And what would you say is a common misconception with that as well?
I would say people are just scared to get a colonoscopy. They're scared about the prep. They're scared about the procedure. And it's really not that big of a deal. And we want to do the gold standard when we're screening for any kind of cancer. This is very preventable and treatable cancer. Talk to your doctor and get it done.
And are there other options for those who aren't ready for a colonoscopy?
There are, but again, they're not the gold standard. So there's some at-home tests you can do, some blood tests and some fecal screening tests. The problem is if they're positive, you still need a colonoscopy. Versus if you go ahead and get your colonoscopy, you can get a polyp that's precancerous or cancerous taken out and be done.
And can you talk a little bit about that process for someone who's never had it done before? What does that look like for them?
Sure. So you're going to first meet with the provider that does colonoscopies, and they're going to explain the procedure to you. And then you're going to get a kit to prep with, and there are different versions of those. So it depends on the provider as to how they're going to want you to prep. But the day before, you're going to prep for that. And then the next day you'll need somebody to drive you to the procedure. You get a great little map. And they take out any polyps if there are any. If there aren't, that's even better news. And then based on the results, you'll get another colonoscopy. It could be 5 years, 7 years, 10 years, depending on what your results are.
And if someone has a history of the disease in their family, when do you recommend them to go in?
So they need to talk to their doctor. Depends on the age of that person, but usually it's going to be around 10 years prior. So if your parent had it at 50, you would probably start screening at 40.
And what would you say are some best practices to help stay healthier, to possibly avoid the disease?
So healthy diet, avoiding saturated fats, processed foods, a lot of sugar, exercise is hugely important. Those are the big things.
And can you talk a little bit about your practice and what you do on a day-to-day?
Sure, I'm family medicine, so I treat pretty much everything.
And if someone's interested in coming here and booking an appointment, how can they do so? What's the best way to connect with you all?
Just call our office. It's Lexington Family Practice, Forest Acres, and they can get you set up with an appointment.
Awesome. Thank you so much for your time.
Thank you.
Of course. We appreciate you.